of its use. So we'll get back to questions, and we have one over there already.
Are you still taking some from the last question session? My question is more related to DBS.
Any question, anytime. Yeah.
Okay. Actually, you answered my first part of the question about being last, whether you should use it as a last resort or not.
Can you put the microphone a little closer? There you go.
Yeah, I love this stuff. What if we and still looking at it as further down the road, once we make that option, how's the technology situation with DBS? Is it going to? Are we going to? I'm looking at it for a very long time.
Right.
Right. How would it last?
So let me just summarize. So the question is, I'm thinking about DBS, but I'm worried that a future model is going to be better, and I don't want to get an earlier model because of the future model. So I would relate it to the car. All right. So yes, there's been many advances since the Model T, but it still is just something that takes you from point A to point B. All right. So DBS is providing stimulation to the deep structures associated with control of motor. And yes, there are new models, even within each company. There are new batteries, new ways of programming, and so it's going to always evolve. And remember, the wires are in the brain, and the battery is in the chest wall. And the battery can be changed, which then is associated with the controller. So there'll be some evolution, and of course there needs to be. These are publicly traded companies. They need to have new products. They need to have new sales. So if your disability warrants it now, it should be utilized now, because your health may change over the next decade such that your Parkinson's symptoms may not be amenable to the benefits of DBS. You may have cognitive problems, you may have blood pressure problems that aren't benefited by DBS, and you've maybe given up quality of life waiting. But if it's not time, then you should wait. And so you and the doctor should make that determination. But I wouldn't wait for a newer model for the sake of the new model. Does that make sense? Okay. Next question.
Yes, you said between 400 to 600 milligrams of Levodopa.
A little closer to the mouth.
Yes, you said between 400 to 600. Was that 400 or number 4?
Yeah. So our general guideline for levodopa dose per day, we like to use 400 to 600 milligrams as a kind of top window when patients need that amount. Now, some patients need more, some patients need less. But 400 to 600 is a good place to use as a guidepost for chronic treatment. So that's 400 to 600 milligrams a day.
Are there groups or categories of Parkinson's disease that you can put a patient into to someone now predict what's down the road for a given patient?
Yeah, so the question is, are there subcategories of Parkinson patients that help predict future progress? And so there are certain genetic forms that we can test for. Unfortunately, most insurance companies won't cover the cost. And remember, that's only about 15% of patients have a genetic form. And there have been studies looking at those subtypes that help guide long-term outcome. Now, but every patient is different, even within the genetic components. But outside of the genetic components, there's certain presentations that generally do better than other presentations. So if you present with tremor and slowness on one side versus balance problems, you're likely to do better long-term with that one-sided tremor, slowness progression than early balance problems. Early thinking problems also is a poor prognostic sign. So it's really individualized. And then, of course, how much fitness insurance do you have? and how healthy are you otherwise, because those things will affect your long-term progress as well.
First of all, I'd like to say thank you to every one of you out there in front, and thank you very much, Corey, for everything you do. I forgot to say brother Corey. But anyways, I had DBS in Pennsylvania in 2015, and I was listening to other people. I know men don't listen as much as women. Women can say thank God. But anyways, after I got my DBS, I thought I could go off my meds because someone told me you don't have to take so many meds. Well, I was a basket case, and now I take 15 pills a day, which is 5,200, and I still have my tremor. I asked my neurologist if I can go down some, and that didn't work. He went up. But
Yeah, so the question is, if you get DBS, can you stop your medicine? So I showed you the pyramid. So the bottom two categories don't get taken out of the pyramid. So DBS is an adjunct to try to make you as good as we can, utilizing all elements of the pyramid. So whereas some patients can reduce the dose of their medicine, perhaps, it isn't the primary goal. The primary goal is to make you the best we can, utilizing all of the components of the pyramid. So I never tell patients they'll be able to come off medicine. I don't even say we can reduce it. We'll reassess when we've optimized the programming, which takes time. And so it's important to set realistic expectations when we're going to pursue deep brain stimulation. Because if you have unrealistic expectations, one, you won't meet them, and two, you'll develop likely depression and withdrawal and things because now you've not had the success. So we'll talk more about that, but I think now is time for some vocal exercises. So who is going to lead us in vocal exercises? And here's the microphone. So everybody's going to participate in the loud component today.
We're going to actually do dual, big movements and loud. So stand up. Or
Everybody can
seated.
stand, please stand. Otherwise, please stay seated if you must.
Okay, so for everything, you want to be loud. Think loud. If you're not feeling like you're projecting, like I'm having to do right now, then you're not loud enough. Now, you're not gonna, I want you to blow us away. I want you to make everybody kind of clench a little. So, some of the exercises from the LSVT Loud are just doing loud ahs. And we'll add a body movement with it.
We can do a side step with our hands and follow with our eyes, and you're going to provide your voice as well. And this is not only beneficial physically, but it's important to mentally have some component of your exercise. So you're having to remember sequences and to do these things. So that's really important with any of your exercise programs, whether it's boxing, Pilates, or anything. So we're going to add some a little bit of mental challenge too, and have to remember the sequence. Okay. Okay.
She said it'll be pretty basic, it won't be too difficult. So one of the ah exercises is just doing ah for as loud as you can. Ah. We got some singers in the room. Okay, and so then let's add in the movement with it. We'll go high, and you're just gonna hold that as long as you can. Take a big breath, and you're gonna be loud.
And as you're doing that, we're We're going to move out to the side, and I want you to follow your hands with your eyes. We'll go to the right first and then to the left. You might not be able to move as big as you'd like because it's a little crowded in here. But always follow your hands with your eyes with this exercise, okay?
All right, take your breath, be loud. And always go back to center. And then we're gonna go to the other side, we're gonna go low. Ready? When you finish, back to center. So we're gonna start a choir. We'll do it one more time on each side, and then we'll get back to it. So high on the right, low on the left. Remember that. Ready? High on the right, right to your left. Back to center. And low. Back to center. Good job.
Very nice. Okay. All right, let's get into the next section. We'll take more questions, but we're moving along nicely, actually. We're going to get through everything. So the next section is Doctor, what about? And I think you'll enjoy this section. Nobody's asked any questions yet about these topics, so I think we'll have some good exchange. I'm going to start with the first one. And I don't know, this might be considered the wonder drug. So I reviewed 11 studies, 917 patients in these studies. So 3 of the studies involved patients who didn't need any treatment. 2 involved patients without those ups and downs, but needed maintenance treatment. And 6 of these studies involved patients who had those ups and downs. And across all of these studies, there was a 50% improvement on the total motor score, or at least a positive change of at least 2 points on at least 2 items. And for those of you that see me, we do this every time with the tapping, and that's the motor score. So, I mean, this is really quite an amazing agent. So 50% had a total motor score or positive change. Overall, the positive response rate was 16%, a range of 0 to 55, and the greatest proportion of improvements occurred in these patients that had the ups and downs. And I don't know of anybody who is prescribing this, but it's a very effective drug. And it's called placebo or sugar pill. So I bring this up because when you ask Doctor, what about? It's important to recognize that any intervention, including placebo, can have a profound effect in Parkinson's disease. And so it's important that we always test agents versus the placebo response, which comes from Latin. I took 4 years of Latin. And placere means I will want to please. And so obviously any intervention, the patient will want to get better. And so that's the importance of doing placebo-controlled trials, because you have to adjust for the amount of benefit from the placebo response and the expectation of benefit. And it's well known in Parkinson's, perhaps better than any other disorder, because placebos have shown to enhance the release of dopamine through those scans that I mentioned. We can actually see it. And so it's very important that any intervention be tested against placebo. Okay, so caveat with everything else that we're going to talk about today. So let's get into the favorite topic, and that's marijuana. So we're going to talk about marijuana and related products to marijuana. So let's just get an idea of where we stand. So medical marijuana is legal in 33 states and the District of Columbia. 10 states also have legalized the recreational use. Texas has neither. So, but the U.S. government still considers cannabis and anything related to it as a Schedule I compound. What does that mean? It means that there's no accepted medical use, there's a high abuse potential, but it can be given to humans as part of an approved research protocol. So there is no physician, according to the U.S. government, in the whole U.S. that can prescribe a medicine, though it can be recommended, okay? But in Texas, we can do neither. So, but in those states that have medical marijuana, the U.S. government still considers them violating the law. Okay, so it's important to have that foundation. All right, so what is cannabis? All right, well, cannabinoids, there are two species, sativa and indica, and there's 105 biologically active compounds found in the marijuana plant. Okay, the two pictures are there. Some of you may be more familiar than others. Well, what are the chemicals that are of importance to us today? So there are two main chemicals within the cannabinoids that are investigational drugs. So they're THC, tetrahydrocannabinol, and cannabidiol. So THC and what everybody asks about, CBD. Those are the two most abundant neuroactive cannabinoids. The sativa strains have higher THC, associated with euphoria, and the indica strains have a higher CBD component, which is associated with sedation, anti-nausea, and pain relief. So that's important to recognize. That's the two chemicals. Those are the two chemicals from the two different plants. Now, well, why do we even think there could be a neurological reason to use these agents? Well, it's because of the study of certain targets of THC. When this was studied, we found a class of receptors in the brain. It's not because of THC that these receptors are there. These have been around since mammals existed. So the system was there. There are two main receptors, CB1, which is mostly what we're interested in. It's in the central nervous system, especially in the basal ganglia. And CB2, which is primarily in the immune system, but also in the nervous system, and may be important when we talk about the extra movements in Parkinson's disease. So when we looked to see if there was any receptors, it led to the discovery of this very complex signaling system. Okay, so it wasn't, as a reason to find it. It was through seeing if it stimulated anyone. So through binding, the endocannabinoid system is involved in regulating many functions. The normal one, we produce endocannabinoids normally in the body. They have many functions. It's not just external. The internal is